Now we're thrilled to announce Ashish Shah. He's the CEO of Dina. He founded Dina in 2015 with a mission to transform in-home care, making it more accessible, dependable, and transparent. A recognized thought leader in health technology, Ashish previously served as a CTO at Medicity, where he led efforts to connect healthcare providers and improve data sharing across over 1,300 hospitals. Today, Ashish and the Dina team are working with top health plans and providers to extend care into the home, helping people live their very best lives. Please join me in welcoming Ashish Shah, a leader dedicated to innovation and compassion in healthcare.
Good afternoon, everyone. Hope everyone's doing okay after lunch, well fed, hydrated. Thank you for all the conference organizers and for all of you for an opportunity to speak with all of you for about 20 minutes. I'm going to put my phone down here and see if I can stay on track here. I think this morning's sessions were incredible. I think, just really emphasize the importance, of course, of empathy, the theme for the entire day and for this movement, but really the importance of caregiving. And I know that there's a lot of different ways to frame it. I thought Alex did a wonderful job talking about the panini, trying to figure out what type of panini I am, but it's... She's an incredible brand ambassador, and she killed it this morning. And so I thought what I would do today, the transition into the afternoon content is really focused on, so how do we take these wonderful ideas? We clearly know there's a problem. It needs to be addressed. There's a lot of different ways to innovate around it. And how do we actually take those innovations and bring it into market? And ultimately scale it and get it into the hands of people, whether they're professional or family caregivers or others across the healthcare continuum that could really benefit from these wonderful innovations. And I thought the best way to do that was to kind of take you through the journey of a company that I founded, almost 10 years ago now. So it's, I often like to talk about things happening overnight, and then you blink and you end up 10 years later, you're still in the game, still working on the same general problems. But what I intend to do today is just kind of take you through our journey really quickly. Just as a backdrop, a lot of what we heard this morning towards the end of the session was how do we ultimately finance or fund these wonderful innovations and get them into market? And so I want to talk to you a little bit about some of that. Before I do that, and I'll eventually tell you what Dina is at some point, but I thought I'd just give you a little bit of my background. The introduction mentioned I used to be the chief technology officer of a company that was a healthcare technology company that built health information networks across the country. We were, at one point, the largest builder, operator of these health information exchanges around the country, 1,300 hospitals, over 2 billion clinical transaction and data sharing moments. So care coordination is something that is near and dear to my heart. That company ultimately joined forces with Aetna, which is one of the leading top 5 payers in the country. And that was a really wonderful experience. 6 months after that, though, I was sort of introduced to caregiving and some of the challenges with it. My dad suddenly passed away, and he was being seen by in-home caregivers. He was in and out of senior centers, and I knew nothing about this space. I knew about primary care and specialists and hospitals and payers. But when it came to caregiving that took place in the home and community, didn't know, couldn't tell you the first thing about it. And as we spent time with people who were around him, they saw a decline coming. And that was sort of the first sense that, that doesn't necessarily feel right. So he was definitely around some interesting people. They had observations around his decline, yet the information wasn't being shared with anyone who could meaningfully intervene or take action in a way that perhaps would have changed his trajectory. We'll never really know. But I know that was something that sort of stuck with me at that time. And eventually, after meeting some wonderful people at Aetna, decided to take a leap, like many in the room here as innovators, really passionate problem solvers. You got to commit to something that you really want to drive change for, and then you got to figure out how to make it work. And for me, the first step was to really understand, and some of these slides are going to be a little bit difficult to read, just given some of the coloring, but first step in that journey for me was, hey, is my experience unique, or are there others in my boat? And at least in the US market, 10,000 people are becoming Medicare eligible every single day. Actually, the number is higher. I think it's north of 11,000 at this point. And as I started to spend time on listening tours and engaging with others, I found that my challenges were not unique, that we are going to have what is being framed by some as the silver tsunami, where more and more people will enter into this 65 plus bracket and have some serious caregiving needs. Now, some challenges with that is we've heard a lot about unpaid caregivers, but if you look at professional caregiving, there's a huge workforce shortage. And so we're asking people to do more with less for more people. And when we started this 10 years ago, I would get a lot of nods. And then COVID came, and I think we, for the first time, felt like we could experience what it looks like when a healthcare system is taxed and pushed almost to the edge. And I think we're seeing some of the downstream repercussions of what's happening to the professional healthcare workforce as a byproduct. So this was clearly a problem. Something needed to happen in this particular space. But when we talk about the financing of it, we're on track to spend $1.5 trillion in Medicare. So when we talk about where's the money and how do you finance these incredible innovations and problems that we need to solve, trust me, this is kind of like seeing that we have 10,000 people turning 65 years old a day and that we have a shortage of professional healthcare workers. The money, there's a lot of money there to save and to scale our broader healthcare system here. So the numbers are big. And when we started the company, we didn't really know a whole lot about Medicare Advantage or Managed Medicaid or PACE programs or many of the government-sponsored programs in the United States that are really incentivized to do a great job caring for seniors, for those who are underserved, who have other unique needs. And so it took us some time. I wish it was maybe on day one, but it took us a little bit of time to identify that these are some of the folks who care the most in terms of being able to finance a vision that will improve access to these services for seniors in particular. And as we dug in a little bit deeper, we found that improving access to home and community-based resources, so identifying needs, navigating people to the appropriate resources, much of what Alex talked about when she had us go through that quick journey, but then also staying connected and coordinating that care over a longitudinal period of time is really important. And it's the centerpiece of many of the innovation programs within these programs, within many of these health plans today. So there's a big problem and there's a big opportunity. And I think for many of the innovators and entrepreneurs in the room, I would say you're in a good space. First of all, you're trying to do good by doing well and helping others. That's always a wonderful start for impact work. But secondly, you're operating in a really large market and there's a lot of problems to solve. This is going to be really difficult for you to read, but as we dove a little bit deeper into payers, or Medicare Advantage plans in particular, although they're identifying improving access to care at home services, so things like personal care attendants, nutrition, transport, housing, which is something that I'm really excited to learn a lot more about being here at New Cortland. These are essential services, and yet when you get deep inside of a health plan or a payer, they don't really understand this space. And it's a highly fragmented space. This is the edge, this is the bleeding edge of innovation, so I think there's an opportunity to really educate and promote what these various benefits can do on behalf of the beneficiaries. Second, there's a lack of performance data. In the US, we talk a lot about star ratings, right? We rate Medicare Advantage plans, we rate providers, we rate home health agencies. How do you rate pest control? How do you rate nutrition programs? How do you rate housing programs? This sort of data is not yet flowing through the traditional US healthcare infrastructure. So I think these Medicare Advantage plans in particular don't have a lot of good quality data to identify who's good and not, and who's more likely to drive an innovation forward. Finally, antiquated technology. What I loved about the Pleatley story in the fireside chat, and thank you so much for inviting us and organizing this, was communication is still challenging, right? I mean, how many of these stories have you heard personally in your own lives or in this room here today where simple, basic communication is really difficult? And if you want to see how tough it can be. Follow somebody on their journey and jump into numerous phone calls. Sometimes it looks like a trading pit when you walk into one of these home care agencies, or the healthcare industry, which is notorious for keeping the fax machine alive. This is what we're really up against. So, we had to get detailed about the types of problems. Then we had to get a little bit deeper and say, so why does access to these services, caregiving services, matter? And what is the impact? And I'm going to give you a few examples, but let's start with home health. So when you've got a senior who perhaps has come out of a hospitalization and they're transitioning on their journey back to home, sometimes they need to go to a rehab center. Eventually, you want to get them back up on their feet, healthy at home. And the difference in somebody receiving home health within 7 days versus a day is remarkable. And just to read some of this to you, when there's a 7-day lag, you see 31% higher emergency department visits. When you have a 7-day lag, you see 40% unnecessary hospital readmissions take place. When you have a 7-day gap, you can see mortality increase by 22%. When you have a 7-day gap, you can see 90-day total cost of care for that health plan trying to manage a cost for that beneficiary really increase. These are real numbers. This is the business case, at least in our particular scenario, as to why solving this problem really matters. You could put caregiving benefits at the center of your innovation model, and you can use that to attract members into your plan, which is great. It's a wonderful start. But when you really think about why it matters, the impact, following that math all the way through, this is how we start to attack a little bit of that $1.5 trillion in spend on the Medicare side of it. Not perfect and maybe not applicable to every type of solution out there, but this is a bit of the journey that we've had to follow to really advance getting our innovation into market. So what is Dina today? Dina is really a technology platform used by government-sponsored programs, Medicare Advantage, Medicaid, PACE as an example, to really improve access, reliability, and transparency to care that's being delivered in the home and community. It's a really simple idea. We've been at it, as I mentioned, for some time. And today what that looks like is when our platform is in place, we create an opportunity to improve access, streamline coordination, boost productivity. That's how we take our innovation to market. There's a lot of people who could benefit from our innovation, many. And I would say one of the toughest jobs as an entrepreneur is to stay focused on the ones that you're going to launch with right now. When we started this business, we worked with health systems, we worked with home health agencies directly, but eventually we had to zoom in on who we're going to focus on because we have limited resources. We don't have the benefit of being a multi-billion-dollar enterprise that could spread our resources really thin. We had to kind of pick our spot, and for us, it was really zooming in on helping Medicare Advantage and managed Medicaid plans right now because that was going to be the source of creating the most value that would allow us to continue to fund our operation. Our products kind of fall into two categories, and today is not so much about telling you about our products, but one part is a digital marketplace, and I do think that's worth highlighting because when we started the company, we actually had a close look at unpaid family caregivers. And what the market told us at that time is, yeah, that's really interesting, but not right now. And what's really remarkable to see is 10 years later, we're seeing a huge movement around that. So I'm a big supporter of it. And what's interesting about our digital marketplace is, yes, we can coordinate home health services and personal care services, home modification. What you're now starting to see Medicare Advantage and Medicaid plans start to introduce is caregiver programs. And that is entering into our digital marketplace. So one of the things I'm most proud of is arranging a whole host of services, and there'll be more innovation. We'll talk about, changes to remote patient monitoring and personal emergency response systems. I expect our marketplace to continue to expand, and our goal will continue to be to unlock faster, timely access to the very best innovations that allow people to live on their own terms. Data was mentioned a little bit earlier today, and so I do want to touch on that really quickly. There's lots of data in the healthcare continuum, but around these types of innovations, it's tough to find. If you want to analyze total cost, you can get a claims extract and look at what the breakdown was by CPT code and what the spend was for an individual. If you want to analyze clinical outcomes, you can get to EHR data inside of a hospital or ambulatory care or post-acute. But when it comes to these innovations, the data's messy, unstructured, and people don't generally understand it. And so a message to everyone in the room as you sort of define your innovation, you're going to have really interesting data. You need to think about how you package it in a way that the recipient, the financer of your innovation is going to understand it and why it matters to them. There's going to be a lot of experience and quality data that comes with it, of course, but you almost need to wear two hats. One hat is why you got into this game to begin with, which is the passion, the energy, the problem that you're solving. And then you got to take that hat off sometimes. You got to put the other hat on, and you need to think about the buyer. And they may use different words. They may care about different things. And that's okay. But part of that translation is, I think, what makes innovation really work in this space. What I want to leave with finally is nobody does anything alone. And what's really great is this is the beginning of a really fun community. I'm excited to see this evolve year over year, but we're fortunate that we were able to recruit some really great people around our movement, but that also meant some really great investors who believed early. Some are traditional financial investors here locally. Osage Venture Partners is supportive of our company, but we also have some strategic investors, providers and payers who decided to step up and support the vision and actually help us advance along the way. That's been very great for us. Jefferson Health, Beata Home Healthcare, Scan Health Plan, to name a few, as some non-traditional investors. And so the final thing that I'll leave you with is innovation around this is in every aspect. The product, who you take it to, how it gets paid for, but also how you bring the right cohort around your business. And I just applaud all of you for all the work that you're doing. I really appreciate, again, the opportunity to be here to share a little bit about my story. And I'm excited for the afternoon to really unpack the reality of how you get innovation into the market. So thank you. I'll be here during the cocktail hour as well. Would love to chat with as many of you as possible.